Wow, since everybody and their mother and their children and their fathers and everybody's getting COVID right now and it's sounding pretty bad, I thought we need to talk about POTS, give a little POTS refresher, because POTS is a post-viral illness. It also comes from pregnancy or surgery or autoimmune conditions or connective tissue disorders, many things. But POTS, postural orthostatic tachycardia syndrome, can come from COVID because it can come from viruses, post-viral illnesses. Let's talk about it. So POTS, postural orthostatic tachycardia syndrome. What does that mean? Well, postural orthostatic essentially means your posture while standing upright. Tachycardia, that means a faster than normal heart rate. That's any heart rate over 100 beats per minute is a tachycardia for adults. It's tachycardia. So standing with a faster than normal heart rate. Syndrome means any condition with associated symptoms. So when you're standing, you have a faster than normal heart rate with associated symptoms. That's what POTS is. It's having a faster than normal heart rate when you're standing with associated symptoms. The specific criteria, however, for POTS is that when you go from laying to standing, your heart rate is going to increase by 30 beats per minute or more in the first 10 minutes when you go from laying or standing. It was my understanding, and my heart does this, mine does this, when I go from laying to standing, my heart rate it increases by 30 beats per minute or more, usually more. And it stays high. Some people's goes down. It was my understanding always that it persists and stays high, but I don't know, we need to do a lot more research on dysautonomia. Unfortunately, we are really slacking on dysautonomia. There are only 6 autonomic dysfunction labs in the United States. There was only 1 federal autonomic lab, and they've been trying to close it down, which is really sad, upsetting, because COVID's getting so many people with POTS. There's over 6 million people with some type of dysautonomia, and we're trying to close down the only federal lab. It's why are we doing this? I don't know. It's wild. We should probably get more money doing this, right? Anyways, let's talk more about it. So POTS, like I said, it's a type of dysautonomia. Dysautonomia, you might not have ever heard of that. So dysautonomia, that means it causes dysfunction of your autonomic nervous system. Your autonomic nervous system is comprised of 2 parts. Your parasympathetic nervous division, that is your rest and digest state. So that's your state of being cool, calm, lower heart rate, you're digesting, you're not peeing, you're not sweating, your low breathing rate, you're comfortable, you're feeling good. The other side is your sympathetic nervous division, and that's your fight, flight, or freeze state. That is a high heart rate, high breathing rate, you're peeing a bunch, you are not digesting, you're sweating. That's a sympathetic state. That's a fight or flight or freeze state. We all know that state, that really anxiety driven state. And these 2 states, they work in opposition. When one is on, the other's off. You cannot be in your rest and digest and your fight or flight freeze at the same time. You're in one or the other, not both at the same time, okay? So when you have dysautonomia, dysfunction of the autonomic nervous system, those systems are out of whack. And the autonomic nervous system is in charge of pretty much all of your involuntary bodily functions. Like I said, your heart rate, your digestion, your urination, your kidney function, your sexual function, your pupil size, your sweating, your mucus production, your saliva. So many things that you probably never even thought of. So when you get dysautonomia, you are going to have a lot of symptoms. Temperature dysregulation, obviously the lightheadedness and the dizziness, potential fainting, or at least feeling like you're gonna faint, headaches, and but then you have blurry vision and pupil size changes and sweating. You're gonna have usually delayed digestion issues, constipation, nausea, vomiting. You're going to have bladder issues, overactive bladder, feeling like you have to pee all the time because you're kind of in that sympathetic state most of the time. You're obviously going to have that high heart rate. You're going to have a high breathing rate. So people tend to feel like they have air hunger, you feel like you just can't catch your breath. You're going to feel out of breath most often. People experience tremors, pains, you get clothes hanger pain, you'll get side stitch pain even from POTS. There are so many symptoms when you have POTS, which makes it very confusing and very difficult to diagnose, because you may really latch on to the fact that you feel super nauseous, and you may try to go to the GI doctor, and they're not going to be able to help you because your real issue is that you have POTS. The real problem is that when you go from laying to standing, your heart rate is increasing. That's like the main symptom that you need to tell a doctor, but you may not really be realizing that. That's why it can take people decades, years to decades to get a POTS diagnosis. That's why I'm telling you about this right now. Because if you have COVID, that's a virus that can cause POTS. So if you're going to have these symptoms post-COVID, know that that could be POTS. You could be dealing with POTS. And if you do, this is what you should do. Sorry I get so excited about POTS. What can I say? I love the autonomic nervous system. I wanted to be a veterinarian. I went to vet school. I had to drop out. Some pretty bad stuff went down. Anyways, it doesn't matter. I remember learning about the autonomic nervous system and physiology, and it was my favorite thing. I love the autonomic nervous system. So fitting now that I dysautonomia. So anyways, if you suspect that you have POTS or any type of dysautonomia, that's the thing, is there are many types of dysautonomia. Dysautonomia is an umbrella term for any condition that causes dysfunction of the autonomic nervous system. POTS is just one type of dysautonomia. There's also orthostatic hypotension. That's when you stand and your blood pressure drops. There's vasovagal syncope. That's when you stand and your blood pressure drops due to upsetting triggers and things like seeing, blood or being too overstimulated, certain things. Then there's multi-system atrophy, there's familial dysautonomia. There are many different types of dysautonomia, actually. Not just POTS. But I digress. If you suspect you have some type of dysautonomia, like POTS, I recommend finding a doctor who knows what the heck they're talking about, or else you're probably just going to be gaslighted and laughed out the door, which is really annoying. So I recommend checking out Dysautonomia International's physician directory list. I have it linked. If you go to that main profile thing of mine, you can click in there and find the Dysautonomia International physician directory thing. And that says a list of doctors around the world who really know about dysautonomia. God, my head hurts so bad. I hate this so much. If you can't find a doctor on the list, and you may not, because that list is super sparse. And like I said, there's just not enough doctors that really know about dysautonomia. Even in the United States, there's only 6 labs to teach doctors about dysautonomia. There's only 56 autonomic specialists in the United States. That's not enough for over 6 million people. We're kind of just screwed, Luckily, thanks to us spreading awareness, a lot more doctors know about it. When I started seeing my psychiatrist, I have a lot of mental problems too. When I started seeing my psychiatrist in 2019, she'd never heard of POTS. Obviously, she works with me. I have POTS. But many people now are more aware of POTS and have got it diagnosed now. So I asked to be put on gabapentin last week for my occipital neuralgia pain and stuff. And she was like, I don't like to really do gabapentin. It's bad for my patients with POTS. My psychiatrist now knows what medications she likes to use with people with POTS. My dermatologist, same thing. I want to put you on spironolactone, but you have POTS and orthostatic hypotension. This medication's usually not good with people with POTS because it can make you extra dizzy. And I know you have POTS and orthostatic hypotension. Doctors know that stuff now. They didn't just 4 years ago, but they do now because more doctors are learning about POTS. We're getting there because we keep spreading awareness. We keep making all these obnoxious videos that really piss people off. I really do. But anyways, I don't care. It's working. I don't care. It's working. My doctors know about the condition. More people know about it, so it's been worth it. So if you can't find a doctor on that list, network. Find groups. Talk in the comment section. If you're in Minnesota, I will tell you my doctors. I don't give a fart if it takes me 2 years to get back into my doctor. I will give you my doctor's name until we get more. Network. Talk to each other. We have to help each other out. That is huge in my opinion. And obviously, COVID is big right now. It's big and it's scary. It's bad. Wear your mask. Please wear your mask. Be safe. Do your COVID protocol. Stay away from it if you can. If you suspect POTS, get checked out. I love you all. Let me know what questions you have. Bye.